If you've ever had a headache, there is a very high chance it was a tension headache. In fact, this is the most common type of headache worldwide. And yet, despite being so frequent, many people mistake it for migraine, sinus pain, or something more serious. In this video, we'll break it down step by step. What tension headache really is, how often people get it, the symptoms, the causes, the diagnostic process, the red flags you should never ignore, and finally, the treatment and prevention strategies that actually help. Let's go! Tension headache is often described as dull, pressure-like pain on both sides of the head. Patients sometimes say it feels like a tight band around the forehead or heavy weight pressing on the skull. Unlike migraine, tension headache is not usually throbbing, and it rarely causes nausea or vomiting. At most, there may be mild sensitivity to light or noise. It's essentially the muscle and stress type of headache, linked to muscle tension in the scalp and neck, combined with stress and fatigue. Tension headache is by far the most common headache disorder. Around 40 to 50% of adults will experience one in any given year. For some, it's occasional, maybe once a month. For others, it becomes chronic, meaning headaches on 15 or more days per month for at least 3 months. Chronic tension headache doesn't just cause discomfort, it can affect mood, concentration, and overall quality of life. Many patients describe it as living with constant pressure. The typical features are pressure or tightness across the forehead, temples, or back of the neck, pain that is mild to moderate, usually not throbbing, pain that affects both sides of the head. The headache does not usually get worse with physical activity like walking or climbing stairs. There can be sensitivity to light or noise, but it's less intense than migraine. Tenderness in the scalp or neck muscles. A simple way to remember tension headache is steady, tight, and bilateral. So, why do people get tension headaches? The causes are a mix of physical and psychological factors. Stress and anxiety. Mental strain often triggers muscle tension in the scalp and neck. Posture. Long hours at desk, screen use, or slouching strain in the muscles. Eye strain. Uncorrected vision problems or prolonged screen time. Lack of sleep or fatigue. Reduces pain tolerance and increases headache frequency. Dehydration, caffeine withdrawal, or skipped meals can also play a role. Genetics play a smaller role than in migraine. Tension headaches are more about lifestyle and environmental triggers that inherited brain chemistry. Tension headache is a clinical diagnosis, meaning doctors identify it based on history and symptoms rather than a test. The International Classification of Headache Disorders defines it clearly: headache lasting 30 minutes to 7 days. At least two of the following: bilateral, pressing or tightening quality, mild or moderate intensity, not aggravated by activity. No nausea or vomiting, and at most one of light or sound sensitivity. Doctors will also check to rule out other causes if headaches are new, worsening, or unusual. Most tension headaches are harmless. But if you notice any of the following, seek medical help quickly. Sudden severe headache, the worst headache of your life. Headache with fever, stiff neck or rash. Headache with neurological symptoms. Weakness, numbness, confusion, speech or vision changes. Headache after trauma. Headache that changes pattern, becomes daily or suddenly worsens. New headaches in people over 50. These signs can point to stroke, meningitis, bleeding or other serious problems. Treatment depends on whether the headache is occasional or chronic. First, lifestyle and self-help. Regular sleep, meals and hydration. Exercise, stretching and maintaining good posture. Stress management, relaxation techniques, mindfulness or breathing exercises. Limiting painkiller use to avoid medication overuse headache. Medication classes. Simple pain relievers like paracetamol or ibuprofen, short-term only. Tricyclic antidepressants like amitriptyline for prevention in chronic cases. Muscle relaxants in selected cases. Non-drug approaches. Cognitive behavioral therapy. Biofeedback and relaxation training. Physical therapy for posture and neck strain. Neuromodulation approaches such as RTMS or neurofeedback. For many people, the best treatment is prevention. A few proven strategies include screen breaks. Follow the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for 20 seconds. Workstation setup. Keep your screen at eye level, chair supportive, and feet flat on the ground. Stress buffering. Journaling, meditation, or even short daily walks. Caffeine balance. Small amounts may help, but overuse or withdrawal can worsen headaches. Tracking patterns. Keeping a headache diary helps identify personal triggers. Tension headache may be common, but it doesn't have to control your life. By recognizing the symptoms, knowing the red flags, and following treatment and prevention strategies, most people can manage it very effectively. If you like this video, you can check the other one right here. Take care of your brain and it will take care of you. See you in the next one.